Welcome to this month's Heart Bunch video brought to you by Utah State University Extension's Heart Initiative. Today, we're going to talk about how to prevent and protect yourself from falls. At least 1 in 4 adults who are age 65 and older experience a fall, but it can happen to anyone at any age. It's estimated that 1 out of 10 falls leads to an injury that causes the person to restrict their activities for 1 or more days or to seek care for it. Also, falling once increases the chance of it happening again. So while most falls may not lead to injury, we want to try to prevent them from happening in the first place and to know what to do when it happens to us or someone we know. So let's first talk about a few ways to prevent falls from occurring, and I'm going to turn it over to Matt.
Thanks, Gabby. Falling can happen due to muscle weakness and poor balance, so staying physically active can be very helpful. Strength training, resistance exercises, yoga, and Tai Chi are some activities that safely help improve muscular strength and balance. USU Extension hosts several physical activity programs around the state that are tailored to older adults, including the Strong Body Strength Training Program, and contact information for these programs are in the description below. Another thing that you can do is to make changes around your home. Make it easier to walk around and find your way without tripping or slipping. For example, make sure rugs lay flat and don't have curled edges, hide cords behind or under furniture, move furniture, toys, and other items out of high traffic areas, or to make more space for moving around and set up night lights in bathrooms and near floors so it's easier to see when walking around in the dark. And don't forget about your furry friends. Train them to avoid getting underfoot so you don't risk tripping over them.
Great. Another tip is to make sure you get regular checkups. This includes vision and hearing tests and finding out about side effects and any interactions with other medications and supplements you may be taking. Also, please tell your doctor if you have fallen, even if it didn't lead to an injury. Some medications can cause dizziness and small changes in hearing and vision and can increase the risk of falling. So be sure to talk to your doctor. Another tip is if you do fall, try to fall safely and remain loose rather than rigid. For example, when falling backwards, tuck your chin in to avoid hitting the back of your head. When falling, roll on the side into the fall rather than trying to stop yourself. Rolling into the fall or continuing with the motion helps spread out the surface area rather than localizing it into one area, like your knees, tailbone, elbows, or wrists. It might sound scary, but practicing safe falling techniques helps improve muscle memory so your body knows what to do in case of a fall. The Science of Falling is one resource that has many videos that shows these safe techniques as well as articles with loads of information on preventing falls. I'm going to turn it over to Tim to give us some more information.
Okay, thanks, Aaron. Okay, what do we do when we or someone we know falls? First of all, we try to not panic, remain calm, breathe slowly, and take a few moments to calm yourself before trying to get up or move around. It's okay to sit a while you get your bearings. Then assess whether you are hurt. If you can, do a full body check by wiggling your toes and fingers. Move your arms and legs. Feel your shoulders, knees, neck, back, and other areas for pain or tenderness. Then move, crawl, or pull yourself to something sturdy if you're able to, like a chair, couch, or stairs. It's at eye or ground level. If you can't move, try to use your phone to call for help or make a noise to draw attention to yourself. You can also get a wearable fall alert device now. There's many of them available for people. There are options available, so do your homework to find the one that's best for your needs. The other thing you can add to your phone is just ice in case of emergency. Put that in your contacts list. These can be life-saving if you suffer a fall or other medical emergency. You can ask for assistance or get the help that's needed relatively quickly. We'll turn the time to conclude our presentation.
Yeah, thank you. So we wanted to thank you all for watching. If you like this content and want to see more, please subscribe to our playlist. You can also take a look at the resources that we shared in the description. for more helpful information about this topic, including room by room ideas for making your home fall proof and different ways to get up from a fall. Thanks again, and we'll see you on the next Heart Bunch video.